Hello everyone and welcome to AIS platform for another session to share and discuss with you all. Today I'm going to talk about our emotions and how they impact our different organs and why these all emotions become more visible, more reflected and strong at the age of 50 with all of us. So, as you all know, Ayurvedic science is the only science in the world that talk about non-physical aspects and their role in well-being. And from the very beginning, and it is a core part of Ayurvedic learning. And in that non-physical aspect, as we talk about many times, our emotions, which comes up with everyone at any given time, will be happening in our day-to-day life. But majority of the time, situation is that no one give any consideration to them and keep working in their life. We might become more and more aware about what is happening me at a physical level, if any pain comes up in the joint, or if I have a cough, I have a sleeping issue, I have issues with my gut or other problem, metabolic disorders and other kind of problems, we can become aware and we will do something, whatever it might be, whether it is in a use of a wonderful supplement, or we might try to make some changes in my lifestyle, in my diet. But no one give any considerations to the emotions when they are coming and impacting us day-to-day wise. Now, this is where our today's subject is to talk about that. First of all, what kind of emotions impact what organ, and then what happen, and is there any way to mitigate them from the very start so that they don't become stronger and impact us. So many of our emotions will impact the brain. Brain is our vital organ. Then our lung are second important part to talk about in relation to the emotion. Then heart is another organ as equal to anyone else. Then the liver, then the gut, then the kidney. So these are organs which I hope all of us, no matter what science we practice, will consider that these are our vital organs. And we do also accept that various kind of ailments can come up in these organs when their functions start getting affected. Now, another question is, no one even want to talk about that how the functions of these organs get affected at a first place. Yes, some considerations might be that, for example, my liver now, who is responsible for various metabolic function, if it is getting affected, if it has been diagnosed as a fatty liver, or it has been diagnosed with that different enzymes are now running out of their normal ranges, so people will say, okay, you need to stop your alcohol, or you need to stop your heavy fat, or that kind of aspect. Same is with regard to the heart or other organs. But no one given a consideration, and no one even tried to think that these organs can get affected with our emotions also. So what Ayurveda talk about very clearly, that we have various emotions on a day-to-day basis, and they can slowly start impacting on our different organs. So brain get affected when someone is having a lot of anxieties, lot of worries, fear, cheating, lies, and have a lot of traumas and not able to look into them. They will slowly start eroding our brain, and down the track we have various major ailment coming up. Ailment you can simply start from the memory loss, or your simple concentrations problems, simple sleep issues, or then Alzheimer's, dementia, and other impact. And not only at your level, if now a couple is trying to conceive and one or the other have these emotions which has not been looked into, the impact of these emotions will be on the newborn in the form of various ailment, whether we talk about ADHD, ADD, whether we talk about autism, whether we talk about some other problem. But no one gave any consideration that this can be the core cause. Then the lungs are the one which can get more dominantly with, if someone is having emotions related like attachments, grief, sadness, loneliness, rejections, failures, separations. These are prime emotions which directly can impact our different lobes of the brain. Again, if these are not looked into in one's life, they can be responsible for various ailments. Start from a simple asthma is a one problem. Simple cough in a seasonal, you always will start having a lot of that, and then people think my diet is so clean, I am having so much good food all the time, and how come every season or time to time, or my this cough is not going at all, I have done so much and I'm all the time having a cough problem or like that, or dry throat or wet throat or like sort of thing. Then major problem will be, again, pneumonia will be a very common ailment which can associate with these emotions easily. And then the problems are like emphysema and other issue down the track. Then we look at our heart, where stress, jealous, hatred, again failures, impatience, cheating, lies, lack of love, lack of being accepted are some emotions which will impact the individual. And these emotions slowly start eroding from inside one's heart. And now when we talk about heart, I'm sure all of us are very much aware that how heart is so vital than anything else. Heart failure and we are gone. And then before to that stage, there will be so many simple ailment which can start coming to the heart, and then when we try to mask those symptoms, inside heart will keep getting impacted if the emotions are the core part, and emotions are always going to be the core part. Like say simple blood pressure, heart flutters, arrhythmia, irregular heartbeat are the common sort of problem. Then comes up more issues related with the bicuspid valve or tricuspid valve, or septum getting affected, heart enlargement can happen, arteries start getting clogged up. Now, this is one very common problem in relation to the heart, that when the heart arteries get clogged up, many will think that I am only eating salad and my salad is also so organic, certified organic. Throughout my life, I never have eaten any fat or something or like that. How come my arteries can get blocked? And that is where this consideration comes very clear, that when they are going through these all emotions all the time, failures are in life, cheating, lies are the biggest one. That is where the arrhythmia and your heart flutters comes up. Atrial fibrillation is the one of the biggest ailment or imbalance, I will say, which relate directly with the emotions. Then comes our liver. Again, with the liver, you will always say frustration, anger, jealous, hatred, always thinking of harming someone, always having that feeling why someone is growing in their life, not to look at their own shortcoming. But when that happens, that's how your liver will start getting affected and give you so many ailments. And then liver directly relate with the gallbladder, and then the all metabolic other organs, pancreas also start getting affected, and these are the issues again never get looked into. Then kidney is our another vital organ which get affected with many of the other emotions impacting different organ, whether it is emotions of the heart or liver, because they are all directly related with the kidney function. But then in general, direct emotions which affect the kidney is holding and suppressions. If someone is having this throughout their life, unresolved emotions, not solving them, not looking into them, ultimately kidneys will start giving up. And then the colon, where various problems can always come up. Again, your anxieties, fear, cheating, lies, anxieties and all other emotions which are spoken can impact the colon. And then colon can have a simple IBS issue. Then the same issues can turn into, if the guts, other parts are involved, Crohn's disease, ulcerative colitis, diverticulitis, and the polyp is the biggest one which can get formed. Yes, diet will play a huge role in the colon polyp, but then your emotions also impact that. So that is where one need to look at, and you will be amazed to see whenever someone having any suffering and they visit as a last resort to an Ayurvedic practitioner. If Ayurvedic practitioner is traditionally qualified and learned the Ayurveda from the traditional principle, he or she must have learned the non-physical aspect playing a big role in our well-being, and that practitioner will look into the emotional part of the client's state of well-being and trying to structure in a plan for them. Now the next question which I shared with all of you, why these emotions, if someone having them, they become prominent at the age of 50. They come like a bombshell, and that's where the downfall start happening. Again, Ayurveda give you a very clear answer for that. No matter how brave you want to pretend to be throughout your life, the moment you hit the age 50, there is another aspect, there is another component in everyone's body which is more stronger than all of us, no matter whether you are a skinny mini guy or whether you are a biggest bodybuilder of the world. And that is Vata intelligence becoming prominent from the age of 50 onward. And that Vata intelligence is going to reflect all what we have stored deep down and start coming out, and then we will know my self is suffering from this emotion or this emotion, and this my organ has got into trouble. But then what is the solution? Solution, yes, if you are able to identify your emotions in the early stages, you can start working on them, you can understand them, become more aware, follow the advice of an Ayurvedic practitioner, and solution will start reflecting. Sad part is that majority of the client, when they visit their practitioner, first they get bombarded with the various kind of supplement. Even for the emotions, they will say that I can get your stagnated emotions out by performing this energy healing or that energy healing, or I can have a big bang kind of thing on your back and on your lower back, and because your lower chakra get affected, or your this sheath is having a rupture, so many of those things. And the client get carried away with all these advices until they found that whatever is being done for them is really not working, and my organs are coming to that stage of what we call as failure. And by that time it is too late sort of situation. But even in that time, if you are able to visit an Ayurvedic practitioner, they might not be in the position now, if the stage has gone to what we call as stage 4 or so, to reverse, but they can still enhance the quality of your life and then prolong your lifespan in a way when it is possible and it is for the benefit of the individual. But before that, if you have any such problem and you visit an Ayurvedic practitioner who is trained to work on these emotions in a much more better way, when I say better way, means traditionally every practitioner is being taught various kind of method, because that's the biggest part of Ayurveda. So first most important regime which any practitioner will teach you is about daily processing of your thoughts. And daily processing of the thought is like the same way you do daily brushing and scraping. But if you are visiting to a new age kind of Ayurvedic practitioner, or those who have not training more specifically, they will definitely ask you to do scraping tongue, but no one will give you that why you should do your tongue scraping within 3 minutes of you waking up. No one will tell you why you should brush your teeth first and then scrape your tongue. So that kind of consideration will also go with the processing of the thought. Processing of the thought will be advised by many that you can do in a journal. You can write in diary. Again, writing diary, writing journal is of no use if I keep repeating the same mistake next day again. So that is where it becomes very important that we first of all recognize these emotions at a right time, And when we are able to recognize them, we visit without fail, without delay, to a practitioner who understands that how these emotions can be worked out on a daily basis in a right way of processing. Then they know both method of daily processing. And second method, many of you will know, facing the mirror. And I can ask anyone if he or she is so much powerful that I do this facing of the mirror every day, and I have done for last 3 months without even missing in a one day, and I'm still suffering from my various emotions. I can assure you, if anyone following the right way to do that processing, you might suffer from any other ailment, but not from the emotional issue. That's how strongly this processing part of the daily is. But again, if someone has not recognized and gone down and then living with the emotions, and the age comes up at the 50, and then these emotions start reflecting more, then what can be done? Again, in Ayurveda, we have very specific regime, very specific way of working on these emotions. One of the most important part is our Ayurvedic emotional healing program, which again is not like in a journal. People will say, oh, I have done this emotional healing program with so many times and like that. As you can see, many people will say that, yes, I have been given emotional healing program for my colon cancer by my practitioner, and my practitioner told me that you just need to understand that your body has a healing power, which is obvious, very true. Our body has the healing power, but one forget about that your body will have the healing power if you have kept it more clean and pure. If you now have filled the body and still filling every moment, every day with so much of your incompatible substances, and this is what we call as your Annamaya Kosha is affected, how your bodily intelligence is going to help you. And that is why, to have the bodily intelligence working in your favor, your all 5 koshas need to be in a more stable state. And that is again without Ayurveda and yogic philosophy. And when I'm talking about yogic philosophy, again, not those people who just do their legs up and down either on the beach or either in the middle of the sea or in a hot room or somewhere. They will never understand what yogic philosophy is. For yogic philosophy, you don't need to get all the clothes from your body out and become in a naked body and then put your legs up and down and do something. Yogic philosophy is much more deeper than those parts. So coming back to that part, and when you visit those kind of practitioners, they will say, okay, you can wake up in the morning, have a shower, put your white clothes, sit quietly in your room and put your hand on your colon area and then keep talking that I have cancer, my cancer is healing, my cancer is healing, and your cancer will start healing. For God's sake, without any disrespect to those who want to do this kind of practices and make people fool, God help them. But for your own benefit, these are of no use. They don't give you any solution. Solution will definitely come if you will start working to correct the core cause. And that is where your bigger picture has to come. And if it has been identified that your problems has come with the various emotions, you have to work in conjunction with everything. So if your cancer has gone, say, to the third stage, you have to have the intervention from our mainstream medicine, whether they do the chemo or whether they do the radiotherapy, depending upon how far your cancer has gone. But what oncologist is not going to give you that how to prevent that cancer coming back. They have the ability and capability to clean your current situation, but the next part is in hand of an Ayurvedic practitioner who will give you that bigger picture, including how to deal with the emotion. This is one example I gave you that how Ayurveda deal with and help everyone to work on their emotional part. In the same way, apart from the emotional healing program, we have specific clinical guided meditation techniques. Now someone will say, oh yes, I do meditation, I close my eyes and put some earplugs in my eyes and I sit on beach or I lie down on the beach in between the water and then try to do meditation. Again, one need to understand first of all what is the purpose of meditation. There are two kind of meditation. One is for God realization, one is for self-realization. God realization is not in your hand at all. It is something, an individual journey, which again need to be done under the guidance of someone who is having that ability and capability to guide you. But when we talk about clinical guided meditation, this is all for the pathological issues, which again come up from the various emotional issues. And that guided meditation practice is again advised to you by someone who follow Ayurvedic traditional principle, because this is all these various techniques are written in our text, and then those need to be followed and implemented. And then comes up another very important part, because if the problem has now gone to the root level means again if these emotions has gone now to that level that's never been looked into, but now they are reflecting when you have hit the age of 50, then Ayurvedic vibrational chakra sparsha treatment is the only solution which will help. But when I say only solution means you still have to incorporate other components, what we are talking from the very beginning. You have to clean your Annamaya kosha, Pranamaya kosha. All these need to be worked out. Your Manomaya kosha also need to be stabilized before you start getting into the stage of this treatment. Because this treatment is again very, very unique, right? Again, the information about this treatment are in our text, but those information is quite fragmented in different places and different our Sahitas and Nighantus have these information, but not very structured. We get to talk about these depending upon your teacher at that time when we learn. But I want to share that I feel myself blessed that from my very early stages of my life, when even I was 5 years and 7 years, I came in contact with one of yogi who lived in Himalayas, in northern Himalayas part, and I used to go to that temple where he used to live. and pay my respect to him. And that's what, because as a child, you not much understand those values, but still your inner conscious pull you towards certain thing if it is the will of higher self. So as time passed, I went to an Ayurvedic college, graduated, and when I graduated, I thought that I am going to go and see him to seek his blessing before I set up my practice or before I was going to apply for job with the government of India. So I went there, and when I pay my respect and told him that I got now as an Ayurvedic doctor, graduated, and after spending some time with him and trying to take my leave, he said, sit here, you're going to stay with me for 4 days. And I was surprised because I did not make any plan, but you cannot speak in front of your masters whom you respect and love. Without question, I just stay there, and I was given room, and then my teacher, he called me and told me about this aspect of powerful healing. He said, now you are going to get into healing. I'm giving you this gift from today. I have seen you growing from the age of 5 and know you will be in a position to use it in a correct way and help people who need that. So that's where that treatment program I keep using when I was in India with my client, whoever required. Because not everyone require, as I said, that this all relate with the more deeper component, deeper impact and deeper effect. So whenever required, we use that. And then when I came here, I also tried to use it in my clinic, but at the same stage, I thought I will teach also. So we are into that process of teaching that treatment so that I can have some other people doing and performing this treatment and helping them, mankind. But today I thought I will share with you, with people, that to understand that why, in spite of me doing all my good effort, still suffering comes my way. And that's where answer this ancient science has always given for everything, and also an answer for this problem. And they have made us aware that our emotions are the one which will give you so much of suffering, and if you don't able to correct them in a timely manner, you will be hit by them at the age of 50 onward. So try to work out, try to be more and more aware about everything, emotions and your life also, physical part of the life, physical activities. And then one more thing I would like to share here, which some of our students have shared recently. They feel very disappointed and what I should say, that discouraged might be a right word for me to say, from Ayurveda. And their comment was that we took this science with a lot of hope, and with a hope that this will be the right choice, because what whatever we have read through our inquiries before joining these courses, that Ayurveda is a science which can heal at a much deeper level. And now, because when they are in their courses, and again coming with the AIS, their study is a little bit tougher, I always feel, even at diploma level. We make them to work hard because I feel that diploma qualification itself is an independent qualification, and hence we cannot let them just go out without having acquired the knowledge and experience how to deal with the patient. And patient again, not just finding out an Vata Pitta Kapha and giving them that have an Vata tea or Kapha tea or Pitta tea or just do the massage on your body. We try to deal with all the deeper pathologies and help them to structure a plan and program for their client, giving them the understanding that how the pathogenesis, how the samprapti of the disease can be assessed, and how samprapti play a huge role in correcting the problems and reversing the problems. Also giving them the understanding on finding the what impact of the doshas are impacting on your dhatus, and not let them think that, okay, we can just say that, okay, vata aggravation, pitta aggravation, or this. They need to find a reason and logic and relate with each individual's pathology or lifestyle and the factors which are impacting, because one can have the same pathologies, but no two people will have same sort of causes according to Ayurveda, and that need to be identified by a practitioner, and that is where the treatments become more specific. So then they have to do clinical cases, and they have to do case presentation in the class, and then they have to do the cases and submit them. And for that they have to find real patient, and they cannot just do the family members and put their cases, and that's how we try to discourage them that, look, purpose is to find out the right kind of client who are keen to do some healing. And in that process, many students struggle because they feel that they don't have link, or they live in those areas where not many people know about Ayurveda, and when they do so much effort, because for each case at least 2 to 3 hours they put together to take the case history, then putting it together the way we have taught them to understand, and then present it. So it's a lot of work, I agree. But then some of them, when they're not able to find cases, they try to look at some people who are associated with yoga or meditation or those kind of bit of awareness. And their comment was very disheartening and disappointing, that they found that people who are already into this philosophy, if they can't even follow all our regimes and the advice, how we can expect other people will be following this advice? So what their question was, that they get so many yoga practitioners or yoga therapists who are practicing and trying to teach yoga asanas to the public. But then when they look at their lifestyle, look at their diet, and look at the emotional and mental factors, and when they try to guide them that what are the core cause of their problem, they're not ready to change it. And then those students think that it means people will not follow Ayurveda. That is not right. That's where I want to make a very strong statement here, that I agree with you that those people still have their own egos and their ignorance. I feel sorry for them, that they have learned such a valuable philosophy and principles, but not incorporating fully, is only their disadvantages. And that's where they meant to keep having their suffering. But my message is to all my students and practitioners, don't feel disheartened that those small group of people not following those advice or what you have given them, that there is no one out in the world who can follow this. That is where you will see the change is coming and change is coming very strongly. Public is becoming more and more aware that the solution of their problems are only if they will play an active role in their well-being. They have to feel empowered. They are ready for changes. But what they are looking for, such practitioner who can guide them in a correct way, who can advise them in a correct way, so that their problems can be seen, that start making changes from the very beginning. Rationalization, explanations are very crucial for people to understand, and that will come with a confidence from our practitioners. And if the practitioner in their practice are stuttering before giving the advice to their client, that client will never connect with us. And hence, your own knowledge, your own confidence in the modality, what you are following, and your own application of everything what you learn from the day one is important. And when you do all that, that is where a different energy is moving around you. And that again comes from that non-physical aspect, that your bodily own energy will then pass on that healing towards your client. That person who is your client, he or she will naturally start following your advice, and you can see the outcome. So that's what I thought I will share with you, that this whole concept of emotions and how we should try to work on them from the very beginning, not waiting for the age of 50. After 50, they will impact us in a very bad way. And hope this, whatever I shared, can give you some hope to follow the things in a correct way. Thanks, everyone.